Hi, my name is Ahmed C. Henry. I'm presenting an interpersonal communication project today. Several points I would like to address today in my presentation include the sharing of my overarching goal and how it is affected by my personal communication style, a little about my behavioral blend and background based on my uniquely you profile, my own communication barriers and issues I've discovered throughout this class, the resources and strategies I hope to implement to address my own communication challenges. Lastly, I will share my action plan that I'm putting into place to address these communication deficits. Concerning my overarching goal, my overarching career goal is to become a more effective counselor by providing the crucial listening skills of empathy, warmth, and genuineness to my clients. This goal is important to me because as a professional counselor, 3/4 of being a good counselor is being a good listener, according to Peterson. The whole goal of this class has been to identify why we don't listen and to learn ways and strategies to listen better to improve the quality of our relationships in life. A little about my behavioral blend and background. My uniquely you profile, graph 1, this is expected of me, identifies me as a strong, submissive, competent type. On my second graph 2, this is me, I was described as a high SC or competent specialist personality type. I was repeatedly told that I am more a passive type and that people interpret me as withdrawn. It was also stated that I do not like big groups but am motivated to help others. I am people oriented but prefer to be one-on-one rather than in large groups. Also, being more a passive type has been a big challenge for me as a professional counselor. When I first started individual counseling, I was nervous and anxious, but through God's grace, I persevered and got through it. The same with facilitating groups. When I first ran my first group, it had 25 people. I was nervous, I was anxious, but I got through it. And in retrospect, I now laugh at it. However, even today, when I facilitate big groups of, say, 20 or so, I still get nervous and butterflies in my stomach. I countered this beforehand by always praying for God's grace to bring me through and to be a blessing to the hearers. I've learned that if I prepare beforehand what I'm going to say, that this makes a big difference. My professional training as a counselor has influenced me to be a better listener in many ways. One, when doing assessments, I listen very carefully to each detail to carefully formulate a DSM diagnosis for substance abuse. Secondly, my background as a Christian has influenced me to be not judgmental, but to look at the client as a person with worth and value made in God's image. Some communication barriers I've faced basically are not acknowledging the other person and their feelings on many occasions. Being more a cognitive therapist, I've always pretty much concentrated more on what I call irrational thinking and not so much the feelings. Another significant interpersonal barrier in my own relationships is not being aware of the flat brain theory as much, maybe. On occasion having my rational thinking hijacked due to emotions. At times I find myself not fully listening to another person's point of view, but instead formulating and rehearsing my own response to get my own point across with the attitude of usually winning at all costs. One of the biggest communication barriers with my secular clients and people in general is to remember that there are two different competing worldviews. 1 Peter 4 verse 4 says, "They think it is strange that you do not plunge with them into the same flood of dispensation and they heap abuse on you." Another communication barrier has been basically trying not to own the client's problem, as Peterson talks about. Realizing that I do not have to have a solution to fix this person. I am in a relationship or an alliance with this client. We are brainstorming together. So guarding also against giving advice and wanting to fix people. Realizing I'm a support helper. Much like a midwife, I aid and support. And also, of course, not allowing the passivity to interfere. Many times with passivity, you don't build what Peterson calls the level 2 communication with others. So that's something I need to be mindful of. Resources and strategies. I plan to utilize several resources and strategies to correct my communication deficits, including utilizing Peterson's talker-listener card. Once again, being mindful of the flat brain syndrome in my communication and relationships. Also being mindful of what Franz and Weckel call the component of empathic listening, as in reflecting back with new, fresh words with an emphasis on underlying surface feelings. Another important strategy is the principle of reframing or changing perspective. Peterson's, once again, not owning another person's problem. Also, lastly, is the believer being more mindful of all the rich scriptures as a resource, which talk about the power of the tongue in communication. My actual action plan consists of 8 specific steps I plan to add and implement to become a better listener and communicator. First, I plan to aim for communication balancing, once again by creating a talker listener card on my desk to remind myself to listen fully until the other person is finished, to listen without judging, then give my input, to be mindful of what the author Stewart referred to as the exhale-inhale metaphor. Once again, not owning another person's or client's problems. If a client explodes or attacks, realizing that is their issue, their flat brain syndrome, not mine. I do not have to fix them. I am here to help. Remembering the flat brain theory and how the brain can become hijacked, and remembering to play out the tape. Think about consequences. Think. Being mindful of what Peterson's listening technique, of what he calls reframing the rigidity. No absolutionist views. Modified black and white or polarized thinking. Not adopting a win at any cost attitude. Also assume there may be some truth to the other party and their conviction. Many times people hear and listen but will interpret or filter the other person's words in their own way or give it their own meaning, their own slant, according to their own mindset or feelings. In a peer-related article from Australian Psychiatry called Communication Skills in Psychiatry Training, they state ineffective clinical communication practices have been linked to poor patient mental health outcomes and experiences. Mental health clinicians can experience problems communicating distressing diagnostic information to patients and their families, especially about severe mental illness. Evidence suggests that interpersonal communication skills can be effectively taught. Also, communication between patients and clinicians is a simultaneous two-way interpersonal experience where effective communication results in better outcomes for both patients and clinicians. Enhanced outcomes for patients include higher satisfaction, improved insight, better treatment adherence for clinicians, more accurate identification of patient problems, improved well-being, confidence, and reduced stress. So communication is about fostering collaborative understanding and not debating. Next, I plan to reflect more what the client has communicated with fresh words to summarize essential thoughts and feelings expressed. Also, Peterson mentions all the various readings overall have impressed me upon the importance to reflect, mirror, and paraphrase. I plan to add these specific listening skills and concentrate more on implementing more paraphrasing with inflection. According to a peer-reviewed article in British Journal of Nursing entitled Communication Skills Count, the author Davies gives an example of positive inspirational communication in a hospital ward where he describes the environment as one where communication was valued, an environment where courteous, non-judgmental communication seems to have positive benefits for patient and staff. The ward was friendly and warm environment to be in. The author adds, it is this emphasis on person-centered practice within the workplace that provides the most positive impact on the patient. And once again, Peterson makes the point to look deeper to both the words and intentions beneath them and the tone and inflection. Next, learning to recognize the hurt and anger of others' emotions in their speech, understanding and recognizing surface feelings and looking for the tone being expressed, as well as meta-messaging. Reframing, looking for new ways to constantly reframe issues, hopefully in a more positive light. Also, lastly, practice assertive communication to help with my own passivity. Focus more on what Peterson calls level 2 communication in personal relationships, because that is what leads to more satisfying relationships where we develop trust, intimacy, and personal sharing. Lastly, in my conclusion, I would like to end with the quote from Peterson, that empathy is the grace of God quality in people. And I would also like to add the Proverbs 18 verse 21. Words kill, words give life. They're either poison or fruit. You choose. It's Listening well can improve how effectively you work with your business associates, co-workers, and community volunteers. It keeps our friendships vital. It grounds effective counseling, teaching, selling, conflict resolution, parenting, and learning, according to Peterson. Thank you very much, Dr. Wheatley. I've enjoyed my class immensely. I've learned and grown quite a bit. Thank you.